Hello, today we're going to talk about all things nipple shields. All right, let's go ahead and get started. So first off, what is a nipple shield? It's a thin silicone device meant to be worn on the nipple, on the breast, to aid a baby in latching. They come in lots of different sizes. Different brands make them. Some have a cutaway in it to have a space for the baby's nose. Some of them are just round, like this one here. And some even come with an attachment for a feeding tube. So the feeding tube fits. It's built in right on there in the event that we need to supplement a baby right there at the breast. When you're sizing a nipple shield, it's important to get a nice fit. We don't want it to be too big and we don't want it to be too small. So if we pretend that my pinky is my nipple and we put on here let's get a smaller one here. So this is a 18 millimeter nipple shield right here. So you can see there's a little bit of space right here around my pinky. So this is a little bit too big. If I put on a 16 millimeter, that actually fits quite nicely. It's nice and snug on my finger. If we look at that with a way too big one, you can really see the difference there. So the problem with a nipple shield that's way too big is that when the baby's suckling here, it's going to pinch the nipple, it's going to be sloppy around there, and it can cause some irritation to the nipple as well. So number one, make sure you have the right size nipple shield for your nipple, okay? All right, when would you want to use a nipple shield and when would you not? Some babies really need a lot of extra stimulation at the junction between their hard and their soft palate, which is about like right here. It's that far back in their mouth. It can be a very helpful tool in that instance, especially like with flatter nipples, because when you have a nipple shield, the firmness of the shield itself hits that junction between the hard and the soft palate in the baby's mouth and helps the baby remember to, suck. Now it's time to suck and drain the breast, okay? It can also be helpful with a premature baby who doesn't quite have the strength yet and the oral function yet to effectively drain a breast. So when you're using a nipple shield, it can create just a little bit of vacuum here on the tip, allowing this, making it a little bit easier for the baby to transfer more milk at each feeding. So a premature baby, a late preterm baby, a baby that's just not getting it, when you put the breast in their mouth and they're like, I don't know what to do with this thing, that's when a nipple shield can be helpful. A nipple shield is not helpful in the case of sore nipples. And the reason is, if I am a baby and I have a shallow latch, which is probably why you have sore nipples in the first place, if this is my baby's mouth and this is the jaw right here, and then up here is where the nose is, it tends to encourage more of a shallow latch. Where I want that baby's mouth is here, a nice wide latch. So a nipple shield, in the case of sore nipples, tends to just encourage and lock in muscle memory for more of a shallow latch. So I would not recommend using a nipple shield in the case of sore nipples. That's a whole nother video. And really, you should schedule an appointment with a lactation consultant if you're having nipple pain so that we can fix the latch and you can happily and comfortably continue to nurse your baby. All right, so when you're putting a nipple shield on a breast, it seems like you just, plop it on there. But if you do, it's just going to fall off. So this is hard to do with one hand. But if you turn your nipple shield inside out like this and put it on the breast and then kind of stretch it on there, kind of like you're putting saran wrap on a bowl, it will stay on the breast much better. I'll tell you, nipple shields are kind of a pain. It's something when I give a nipple shield to a mom, they're really happy. Now the baby's nursing at the breast. And then the next question is, okay, how do I get rid of this thing? Okay, so it does flop up a little bit. If this is flopping up in the baby's face, hold it back while the baby's nursing. And eventually we will be able to get the baby off of the shield and just nursing straight on the breast. Okay, so I also like to hold the shield like this on the breast so that I encourage that baby's mouth to come on like this, and they have room again for that jaw to get in there. Okay, so if I'm holding the shield back, I'm holding it here with my thumb and my index finger and making a little bit of a sandwich for that baby to get in there and do the deed. Okay, as opposed to leaving it flat like that and having the baby just come at it this way. Okay, not helpful, helpful. Okay, all right, washing these things, pretty simple. Hot soapy water is all you need. You don't need to sterilize them, you don't need to sanitize them. Hot soapy water is all you need. They're all clear, pretty much. I think there's one brand that isn't, but for the most part, nipple shields are clear. They're hard to find at night when they in the dark next to your bedside table. So I would recommend getting a couple of them. Most of them come with some kind of case or a denture cup or something to store them in, and that can be helpful for when you are out and about. But again, cleaning, hot soapy water is fine. You can just rinse it off between uses. Having a couple around is a good idea. We'll do a whole separate video on how to wean from a nipple shield, and yes, it is possible. I've never had a baby who couldn't eventually get off of a nipple shield. All right, that's it for now. Be sure to subscribe and like this video, and we'll talk again soon.